Hello everyone, am I audible? Let me know. Fine. Am I audible and visible? Let me know, then we'll start. Okay, fine. Hello Anshu Kumari, good evening beta. Welcome all, welcome to my class. I'm myself Dr. Deepthi Karya, I'm MD PhD Physiology and we will start discussing physiology topics, okay? Now, before starting my class, I have one announcement that all my lectures, they're available in soft copy as well as hard copy, and if you wish to get soft copy, you have to download the application Vesalius from the Play Store. This download is free and you have to subscribe. Okay, fine. Next is if you wish to get the notes in hard copy, that is also available on Flipkart as well as Amazon both, so you can order on the Flipkart or Amazon for the same. Okay, fine. Another announcement here that in this channel I have started live classes series in which I am trying to complete the whole syllabus of physiology. So if you stay connected with me, it just takes only 40-45 minutes daily and you can easily complete your whole syllabus of physiology in a given period of time. Fine. So now let us start our today's topic. Today we'll discuss about two important topics. One that is classification of nerve fiber and second one that is nerve conduction velocity. Okay, let us start with the first topic, that is classification of nerve fibers. This may be asked as a short note so many times, classification of nerve fibers. Okay, now let us start with the classification. This classification is by different ways. There are 9 ways of classification. First of all, we will remember all the ways. Okay. First, that is depending on the diameter and the conduction velocity. This classification is known as Erlanger-Gasser's classification. Okay, so first classification is Erlanger-Gasser's classification depending on diameter and conduction velocity. Second one, that is numerical classification. 1, 2, 3, 4 numbers are given. Third, physio-clinical classification. Okay, and fourth one, that is physio-anatomical classification. Okay, I repeat, one that is Erlanger-Gasser's depending on diameter and conduction velocity. Second, that is numerical classification. Third one, physio-clinical classification, and fourth one, that is physio-anatomical classification. Fifth one, depending on the structure, they are myelinated, unmyelinated, depending on the distribution, depending on origin, function and neurotransmitter. So there are 9 ways. Hello Sakshi, good evening beta. So again I repeat, if your question is classification of nerve fiber, you have to classify by 9 headings. Let us repeat all the 9 headings. Number 1, that is Erlanger-Gasser classification depending on diameter and conduction velocity 1. Second classification, that is numerical classification according to numbers. Okay. Third classification, that is physio-clinical classification. We will discuss one by one. Fourth one, physio-anatomical classification. Fifth, structure. Sixth, distribution. Seventh, origin, function and neurotransmitter. Okay, we will discuss one by one. First important one, that is Erlanger-Gasser's classification. Okay, here you can see depending on the diameter and conduction velocity. As we all know that diameter, or you can say increased diameter, means the fiber is myelinated. Okay, when myelin sheath is increased, the fiber is myelinated, conduction velocity is fast. And if the fiber is non-myelinated, conduction velocity is slow. You can see here, above downward the fibers are myelinated initially, then gradually unmyelinated, non-myelinated fibers are there. Okay, so you can see here, there are the fibers are A alpha, A beta, A gamma, A delta, B and C type. Okay, gradually diameter decreases. Okay, and conduction velocity also decreases. I repeat, try to remember all this value. A alpha, diameter 12 to 20 micrometer or micron. Conduction velocity 70 to 120. Here easy way to remember, that is uh, conduction velocity, speed of conduction velocity, that is 6 times the diameter. Means suppose your diameter is 12, you have to multiply this with 6. 12 6 are 72. You can see here, this is your 70. So conduction velocity is 6 times the diameter. Fine. So this way you can easily remember. If you have remembered diameter, you can easily remember conduction velocity. Fine. So now you can see here, A alpha 12 to 20 micrometer diameter, conduction velocity 70 to 120. A beta, now you can see this is smaller than this, so 12 less than 12, 5 to 12. Okay, and multiplied by 6, so you can easily remember 30 to 70. Okay, A gamma, now it is less than 5, so 3 to 6, 3 6 are 18, so the velocity is 15 to 30. So always, first of all, you have to remember diameter only, and if you know the diameter, multiply this with 6 and you will get the conduction velocity. Fine. A delta fibers 2 to 5 diameter, conduction velocity 12 to 15. B fibers 1 to 2 micrometer diameter, conduction velocity 3 to 10. And C fibers diameter is 0.4 to 1.2 micrometer, conduction velocity is 0.5 to 2. Okay, these are unmyelinated fiber. Try to remember all these names: diameter, conduction velocity. I repeat, A alpha, thickest fiber 12 to 20 micrometer diameter, the conduction velocity 70 to 120. A beta 5 to 12, 30 to 70. A gamma 3 to 6 micrometer, conduction diameter, conduction velocity 15 to 30. A delta, diameter 2 to 5, conduction velocity 12 to 50. Okay, B diameter 1 to 2 micrometer, conduction velocity 3 to 10. And C fibers 0.4 to 2 and conduction velocity is 0.5 to 2. Fine. Now another thing is, now how to remember functions. There is mnemonic for that. You can see here, easy way to remember: A alpha, A beta, A gamma, delta, and B and C fibers. Okay, I will give you mnemonic. What is this mnemonic? Prime Minister, you can see here, pressurized to sign the contract fast. This is the mnemonic. Prime Minister pressurized to sign the contract fast. Okay, so I'll show you. So A alpha fiber, prime means they carry proprioceptive impulses. Minister means motor from muscle spindle. Okay, pressurized, so impulses from pressure. A beta. T for touch, sign means muscle spindle. A gamma. A delta, the contract fast means touch, cold and fast pain. Okay, B fibers are preganglionic, parasympathetic, and C are postganglionic, sympathetic and parasympathetic both. Okay, preganglionic and postganglionic, B and C fibers. Fine. So this way you can remember functions also. Diameter, I gave you the this how to remember. Diameter you have to multiply by 6 and you will get the conduction velocity. 12 to 20, 5 to 12, 3 to 6, 2 to 5, less than 3. Fine. Here important thing is increased diameter. You can see, greater the diameter of nerve fiber, conduction velocity increases. Means myelinated fibers, the conduction velocity is fast. Important. And second thing is magnitude of spike potential also increases. Means spike is also increase. Height of the spike is also increase if the diameter is more. Okay. Now in myelinated nerve fiber, how to calculate conduction velocity? You have to get the diameter multiplied by 6. Okay, so you will get the conduction velocity. Here you can see the diameter is 12 micron, or 12 micrometer multiplied by 6, your conduction velocity is 70. Fine. Now, next is if the fiber is unmyelinated. How to get the conduction velocity? Here the formula for conduction velocity in unmyelinated nerve fiber, this is not myelinated, that is square root of diameter. Unmyelinated fibers are C fibers. The diameter of C fiber, that is about 0.4 to 1.2 micrometer. So if suppose we are taking square of 1, you will get 1. So maximum 1 meter per second or maximum 2 meter per second is the conduction velocity if your fiber is unmyelinated. Fine. Now, this I told you, Erlanger-Gasser classification and functions. If you have not attended, just revise this. This is the mnemonic for function: prime minister, pressurize to sign the contract fast. This is the mnemonic. P for proprioception. So A alpha carries proprioception. Minister, motor. A beta, pressure and touch. A gamma, sign, that is S for muscle spindle again. The contract, touch, cold and fast pain. Okay. C fibers also carry sensation of pain, touch, temperature. And dorsal root fibers, they also carry pain, temperature, mechanoreceptor reflex responses. And sympathetic postganglionic fiber. This is not much required to be remember, but at least up to C you must remember. Okay, fine. C fibers are unmyelinated, these are. So they carry pain sensation mainly. Okay, fine. Now, so this is about Erlanger-Gasser's classification. Second classification, that is numerical classification according to number. So here the same thing, these are numbers. You can see here. So 1A and 1B is equal to A alpha fibers. So A alpha, what are the functions of A alpha? Proprioceptions from muscle spindle, Golgi tendon organ. Okay, but important thing here is 1A fibers. They carry impulses from muscle spindle in the form of annulospiral ending. We will discuss with the muscle spindle. Suppose this is your muscle spindle. It has got two types of fibers, bag fibers and chain fibers. Okay, nuclear bag fibers, they have this kind of spiral endings. These are your 1A fibers. And number 2, that is flower spray ending, that is at the end here, like flower, this one, this way. They are at the chain and bag both. And these are your number 2 fibers. Fine. So 1A or A alpha, muscle spindle, Golgi tendon organ, they are annulospiral. 2, that are they are from muscle spindle, that is also flower spray type, also from muscle spindle, but the endings are different. Okay, and 2 is equal to your A beta according to Erlanger-Gasser's classification. Okay, then comes A beta, that is 2, we have discussed. A alpha, 1B also. This 1B carries sensation from Golgi tendon organ. Okay, then comes 3 number, that is A delta, and they carry pain and temperature sensation as well as some of the touch fibers, same as we have discussed with the A delta. If you cannot remember, I repeat, the mnemonic which we have used to remember this: A alpha, prime minister means proprioceptions, motor. Pressurize, pressure and touch, that is by beta. Gamma, muscle spindle. A delta, touch, cold and fast pain. So A delta here is equal to your number 3. So number 3 also carries pain, fast pain, cold and touch receptor. Fine. And 4 number, that is for pain and other reception, that is C fibers. Fine. So this is numerical classification. Third classification, that is physio-clinical classification according to susceptibility to hypoxia, pressure, and local anesthetist. Hmm? Easy way to remember here. You have to make a table like this. Susceptibility to hypoxia, HPA. HPA, write down like this. Okay. Most susceptible, intermediate, and least. Okay, so you just have to make a table like this. This one. Most susceptible, intermediate, and least susceptible. Okay. Then HPA. H for hypoxia, P for pressure, A for anesthetics. And easy way to remember, BAC. Write down BAC here. Then again horizontally also BAC. Fine. Now here BB. Easy way. Now here whatever is left, A, B, C. C, B, A. So this way you can remember susceptibility. Am I clear? Okay, or should I repeat? This way you have to make the table. I will just repeat how to make the table. For that, just I repeat. You write down like this. Okay. Most susceptible, intermediate susceptible, least susceptible. Fine. Hypoxia, HPA. Here write down BAC. Here also BAC. Fine. Now here BB. Okay. Now यहाँ पे क्या बाकी रह गया है, ए बी. अभी क्या रह गया, सी. अभी यहाँ सी बी तो ए. अभी इसका मीनिंग क्या हो रहा है, सपोज हाइपोक्सिया. कौन से फाइबर हाइपोक्सिया से सबसे ज्यादा ससेप्टिबल होगी, बी फाइबर. उसके बाद ए और उसके बाद सी. प्रेशर सबसे ज्यादा ए फाइबर, फिर बी और फिर सी. और एनेस्थेशिया हम देंगे तो सी फाइबर, बिकॉज एनेस्थेशिया रिलीव्स पेन. सी फाइबर्स कैरी पेन, तो पेन सबसे ज्यादा बंद हो जाएगा इससे. देन बी फाइबर एंड देन ए फाइबर. एम आई क्लियर? सो दिस वे यू कैन इजीली रिमेंबर. नाउ अभी ये क्वेश्चन कई बार नीट पीजी में भी आता है. आई विल जस्ट एक्सप्लेन यू. सपोज कोई एक इंडिविजुअल है, द पर्सन इज सिटिंग फॉर लॉन्ग पीरियड ऑफ टाइम इन स्क्वेटिंग पोजिशन, तो उसका लोअर लिम है कंप्रेस हो जाएगा. ठीक है, तो प्रेशर आ रहा है तो उसको टच सेंसेशन चला जाएगा. क्यों? बिकॉज ए फाइबर्स आर फॉर टच, थिक फाइबर्स, एंड दे आर मोर ससेप्टिबल टू प्रेशर. पर पेन रहेगा. क्यों? बिकॉज पेन फाइबर्स आर लीस्ट ससेप्टिबल टू प्रेशर. एम आई क्लियर? सेम वे जब हम एनेस्थेटिक ड्रग्स देते हैं तो कौन से फाइबर जाएंगे, फाइबर्स ऑफ पेन विल गो and fibers of pressure touch will remain. So this is the importance of susceptibility. Okay, try to remember this table. Third classification, physio-anatomical classification. Here according to afferent and efferent fiber. Afferent means fibers, they carry information towards central nervous system, and efferent means they carry information away from the CNS. These afferent are also two types, somatic and visceral. Somatic are again two types, जो afferent, somatic, visceral. Somatic are again two types, general, special. General, special. So you can say somatic, general senses here. Now, somatic general senses means these are the fibers, they carry sensation from general receptors, like receptors from the skin, means cutaneous receptors and muscle receptors. And special means they carry sensation from special senses like vision and hearing. Fine. Now visceral means the fibers, they carry impulses from viscera. And visceral special means the fibers, they carry impulses from smell and taste, special visceras. Fine. So this is afferent. Now we come to efferent. Efferent means now these fibers, they carry impulses from CNS to the effector. Okay, efferent are also of two types, your somatic and visceral. general and special. This is fine. Now, so somatic general means these are the fibers, they carry sensation, or they are sensations, they are carrying sensation from skeletal muscle. And special means they carry sensation from eye and ear. Then visceral general carry motor fibers, from viscera, this one, from viscera. And special visceral means motor fibers to the muscles of facial field. Special senses are there here. Fine. So these are the efferent fibers. Okay. So this is our physio-anatomic classification: afferent and efferent, somatic, visceral, general, special. Fine. This is fourth classification. So fourth means first we discussed Erlanger-Gasser. Okay. Second classification, numerical, numbers. Third, physio-clinical, that is according to hypoxia, pressure, anesthetic drug. And fourth, physio-anatomical, that is general, special, afferent, efferent, general, special, somatic, visceral. Fine. So these are four classes. Fifth one, depending on the structure. The fibers are either myelinated or unmyelinated, depending on the distribution, whether they supply muscle, somatic, skeletal muscle, and autonomic means they supply smooth muscle like in the stomach and cardiac muscle. Fine. So somatic and autonomic. Somatic is always they supply voluntary muscle. Autonomic means they supply automatic muscles. They are cardiac and smooth muscle. So that is sixth classification. Okay. Seventh one, depending on the origin, they are originating from cranial nerves. There are 12 pair of cranial nerves. 12 pair of cranial nerves. We will discuss in detail. And spinal nerves, 31 pair of spinal nerves. Okay, 31 pair include 8 cervical, 12 thoracic. You can see here 5 lumbar, 5 sacral, and 1 coccygeal. Okay, so this is the classification. Okay. Hello Anshu, good evening beta. Then depending on the function, these fibers are motor, or you can say efferent means fibers originating from central nervous system, here brain or spinal cord, to the muscle here, that is motor. And sensory means fibers, they or this nerve fibers, they carry sensation from different parts of body to CNS. So this is the classification depending on function. So we have discussed 8 types of classification. I repeat all the types. Okay, number 1, as I told you, first is I repeat, this is the revision: Erlanger-Gasser's classification. Second classification, that is numerical classification. Third classification, physio-clinical, according to hypoxia, pressure, and local anesthetics. If you have joined late, please watch the video completely. Okay. Then fourth one, physio-anatomical classification. Okay. Fifth classification, depending on the structure. Here, structure means the fiber is myelinated, unmyelinated. Sixth classification, depending on distribution, somatic or autonomic. Seventh classification, depending on origin, cranial or spinal. And eighth one, that is depending on function, that is your motor and sensory. Last one, ninth one, that is depending on neurotransmitter, whether the neurotransmitter is acetylcholine, the fibers are cholinergic, and the neurotransmitter is adrenaline, noradrenaline, that is adrenergic fibers. So this is the classification. This may be asked as a short question. You have to write down all the 9 types of classification. Now another small topic we are going to discuss, that is nerve conduction velocity. Okay, now what is the nerve conduction velocity? Suppose this is your nerve. Okay, so when we are discussing nerve conduction velocity means the rate at which impulse is transmitted from this part to this part. This is your velocity. So velocity of conduction of nerve impulse. So whenever we are measuring velocity v, the unit is meter per second. Okay. So here we are measuring the distance. Suppose this is the distance and how much time is required to pass the distance. So this way we can calculate the nerve conduction velocity. And as we have discussed, if the fiber is myelinated, conduction velocity is fast, and fiber is unmyelinated, conduction velocity is slow. Okay, so how to calculate conduction velocity? You have to stimulate this proximal part and distal part. Okay, measure the distance between these two, and then you can see here you will get these two curves. Okay, and measure the latency. This is one latency and this is another latency for the distal. Okay, so latency difference is equal to time required for the impulse to pass through this area. So the difference of time, that is divided with the your distance between these two electrodes, and you will get now conduction velocity. Now various factors they affect now conduction velocity. They are, one is age. Now conduction velocity of infants, that is always half than adult, and the age, at the age of 3 to 5 years this velocity reaches to the adult age, and after, you can see in this graph, after the age of 40 years this now conduction velocity starts falling down, and the fall is 1 meter per second every decade, every 10 yearly. This is normal physiological. Second is gender. In females, sural nerve conduction amplitude, not the velocity, amplitude is smaller than males. Okay, so this is gender. Third factor, that is upper limb and lower limb. Physiological factors are there. Okay, in upper limb always nerve conduction velocity is more than lower limb. Why? Because in the lower limb the distal axons are tapered, small. Internodal distance is also short, diameter is also decreases, and in the lower limb temperature is also less. So nerve conduction velocity decreases in lower limb. Okay, this is physiological. Temperature, nerve conduction velocity directly related to the temperature, means temperature increases, conduction velocity is fast. Okay, and 1 degree Celsius fall in the temperature, conduction velocity decreases by 5%. Fine. So that is fourth factor. Fifth factor, height. If the individual is heighted, definitely the conduction velocity is less. As I told you, distal axons are tapered, internodal distance is less, okay, and temperature is also less. So the nerve conduction velocity is less if the individual is heighted. Weight, with increase in the weight, soft tissues are more, and soft tissues they compress the nerve, so the nerve conduction velocity decreases. Then body mass index, directly not related with the nerve conduction velocity, but if the person is obese, lipid metabolism changes, there is oxidative stress is there, and that increases the risk of carpal tunnel syndrome, that is compressive neuropathy, and nerve conduction velocity decreases here. Okay, some other hand factors are also there. Thank you, Dr. Sheetal. Hand factors are also there, like circumference of the index finger. If the index finger circumference that is more, then conduction velocity amplitude is also higher, so that is also related with conduction velocity. Median nerve conduction velocity, that increases in the individual is having large wrist ratio. If the wrist diameter is large, then the conduction velocity is fast because compressive symptoms are reduced. Okay, myelination, as we all know that myelinated nerve fibers conduction velocity is fast. Okay, nerve segment, in proximal nerve segment conduction velocity is fast because proximal segments are myelinated. Perfusion, if the perfusion means blood flow to the nerve, that is good, definitely nerve conduction velocity is increased because nerve functions are good if the nerve perfusion is increased. So these are all the factors they affect nerve conduction velocity. Here we are ending our topic nerve conduction velocity. Now it's time to give answer to MCQ. If you are live and you can give answer, that is fine, or if you are watching the video, then also you can give me the answer later on in the comment box also. Okay, so let us start with the MCQs. First, that is diameter of nerve fiber is directly proportionate to, and Options are speed of conduction, spike duration, both of the above, none of the above. Okay. So here you can see, as we have discussed, diameter, myelinated fibers, the diameter is more, diameter increases. As diameter increases, now conduction velocity increases. It has no relation with the duration of spike. Okay, it has relation with spike magnitude. Okay, but not the duration. Fine. So your answer is speed of conduction. Fine. Okay, next. Speed of conduction of myelinated nerve fiber is dash times the diameter of fiber. We have discussed A alpha fibers. Diameter is 12 to 20 micrometer. Conduction velocity is, I told you, multiplied by 6 and you will get 70 to 120. This is the value. Okay, meter per second. So now give me the answer. You can easily give me the answer. Speed of conduction velocity is dash times the diameter. This is 6 times the diameter. Fine. Okay. Okay. Next, nerve fiber with maximum diameter, as we have discussed, Erlanger-Gasser classification A alpha. Their diameter is 12 to 20 micrometer. A beta has 6 to 12, 5 to 12 or 6 to 12 micrometer diameter. Okay, I'll just repeat this for you. A beta, the diameter is 5 to 12. A gamma, 3 to 6. A delta, 2 to 5. B, 1 to 2. And C, zero point 0.4 to 1.2 micrometer diameter. So highest diameter is A alpha. Fine. Then intrafusal fibers are innervated by this. I think we have not discussed, but the skeletal muscle has two types of fiber. These are extrafusal, outside, large fibers, and intrafusal fibers. These are nuclear bag fiber and chain fibers. This one, and they are supplied by gamma fibers. A gamma. Okay. So if I have not discussed, this is just you remember. Which type of nerve fibers having conduction velocity 2 meter per second? Okay, this is by C fibers. As I told you, we have discussed this one. C fiber diameter. This is the diameter. Okay. Now conduction velocity, multiply this with 6. 6 fours are 2.4. Okay. So this is your 2 meter per second. So this way you can remember C fibers, the conduction velocity is 2 meters per second. Fine. Next, nociceptions. Nociception, that is pain sensation, that is transmitted. Here two options are there. A delta for fast pain and C fibers for slow pain. Fine. This is okay. Type B fibers. Type B fibers, they are present in somatic motor, preganglionic autonomic fibers, motor to muscle spindle, and sympathetic postganglionic fibers. Okay, here these are preganglionic autonomic fibers. I just explained this autonomic nervous system. It has got, this is your ganglion. What is ganglion? Collection of cell bodies outside the CNS. That is ganglion. Okay. So here, these fibers are preganglionic. They are always myelinated. Myelinated are type B fibers. And postganglionic fibers are unmyelinated. They are C fibers. Fine. So type B fibers, they are preganglionic autonomic fibers. Fine. And postganglionic fibers, as I already told you, they are C fibers. This one. Which are the postganglionic, sympathetic fiber? Both. Autonomic means sympathetic and parasympathetic both. If we are talking about preganglionic, they are always large, B, and post ganglionic, they are C fibers, whether they are sympathetic or parasympathetic. Fine. Next, the type of fibers susceptible to hypoxia. I told you how to make the table, physio-clinical classification. This way you have to make the table, so you will never make any mistake. Most susceptible, intermediate, and least susceptible. HP, hypoxia, pressure. A, anesthesia. Hypoxia, remember BCA, here also BCA, then BB, and here A, here left is C. So this way you can remember. So which fibers are most susceptible to hypoxia? You can see here. From this you can easily find out. This is your B fibers. Fine. Next question is also related to the same. Which of the fibers are most susceptible to local anesthesia? From this we can easily find out. Most susceptible to local anesthesia. Sorry, this is BAC. Sorry, BAC. This is BAC. Fine. So this is ABC, CBA. Sorry. So most susceptible to anesthesia, they are C fibers. I repeat the table again. You can see here. This way you have to make the table. This one. Most susceptible, intermediate, and least susceptible. Okay. High HPA, pressure anesthesia. BAC. BAC. Okay, fine. So most susceptible to anesthesia are C. Here BB. So what is left here? C. What is left here? A. Fine. So local anesthetist agent, the susceptible fibers are our C fibers. Fine. So this is the way you can remember. This is about the topic, that is classification of nerve fibers. Okay, we are ending my I'm ending my topic here. Again, the announcement: you can get all the my lectures soft copy as well as hard copy. To get the soft copy, you just have to download the app Vesalius and subscribe the app, and you will get all the soft copy of all my question and answers. Thank you, Satyanand. And second thing is, if you want to get hard copy, you can order on Flipkart or Amazon. That physiology notes are also available. Okay. Thank you so much. Thank you for being with me and attending the lecture. If you like my lecture, you can like it. You can share with all your friends. Okay, so that they also can learn physiology, and you can subscribe our channel. That is Dr. Deepthi Karia, my channel. You can subscribe and hit the bell icon. Okay, if you hit the bell icon, you can get the notification that madam is live. So always don't forget to hit the bell icon. Okay, तो पता चल जाएगा कि मैडम अभी घंटी बज रही है, अभी क्लास स्टार्ट होने वाली है. ठीक है, तो अभी आ जाएंगे. Thank you so much. Thanks for being with me.